Physical Therapy, a great paper came out really defining what you need to be telling patients. Patients want a diagnosis and they want a clear, consistent message on how to get them out of that diagnosis and then prevent it from happening again. So how do you do it in practice? Here's how I do it. Hi, this is Brandon Steele with ChiroUp, and I'm going to explain how I automate 90% of the things that I do, maybe even 95% of the things I do. Per diagnosis, you should have a best practice recipe for what you do. And what we do is we find out what caused the pain, what we can do to alter that pain processing, and then hopefully find a way to build up the capacity in that tissue so that pain doesn't happen again. And it happens through patient education, activity modification. There's also a lot of different factors, but you can automate most of that. So let me explain this in a graphical format. So whenever we have a patient that walks in our door, they have an injury. And let's say they've been doing a lot of work to their body over a certain amount of time. Let's call this tissue the glute, we'll call it the glute med. And they need to start running. Maybe they have a 5K they're going to train for. And when they start to run, they're going to put a bunch of work and force through that glute med. Now, fortunately, we're self-healing organisms. So what's going to happen every night is you're going to actually go through a little process called healing, which is great. Unfortunately, when we start to train and we train too much, what happens is the next day you go and do a little bit more, and then we have some healing, which is finite based on your health, based on your metabolic systems, and also based on the amount of time that you sleep. And then maybe you feel pretty good the next day and you want to run even more. There is a certain point where that activity is going to exceed the capacity of that tissue, and we call that injury. Most patients perceive that as pain. So what happens is you're going to hit this point, let's call it right here, and that's my pain perception, that I've hit the capacity of that tissue. And the reason I say capacity is because that's when that tissue starts to break down. That's when we start to have injury, inflammation, and that's where most people will have their pain. Not everybody though, and I'll explain that in a little bit. So at this capacity, we have a problem. That's when they come and see us. So what do you do in practice to solve this model? And this model is not for the gluteus medius, this model is for everything. I think there's 3 things that you can attack in your practice, simply and automated, to attack most everything that you do for a patient. So the first is this right here. So between here and here, this little downslope here is what I call healing. So how do I get someone to heal more? There's a couple things. I think 3 things are probably the most important and my heaviest hitters when it comes to getting someone to heal faster. The one is sometimes more difficult than you would imagine. It's stopping the activity. This person wants to get to here to run that 5K, and they want to run. So what are you going to do about it? You have to find a way to get them down, cycle, do another activity, but stop the offending activity, because that's what's causing this pain. The next is sleep, which we just talked about. People discount the amount of sleep they get, and they always think they keep on pushing through, but when you sleep is when you heal. And unfortunately, if you're not sleeping, immune function will downregulate, and also you have increased pain perception. So things you want to think about, we need people to sleep, but consider this. If this person is sleeping and they have a problem in the glute medius, all your healing requires blood flow. If you're sleeping on your side, it's going to create a lot of compression there, ischemia, and reduce blood flow, of course, and reduce the amount of healing. So also consider not only getting more sleep, but sleeping in the right position. Incorporate those infographics and PDFs and patient education to educate your patients on how they're inhibiting their ability to sleep with their sleep posture. And the third is metabolic. Now, I'd rather change your religion than your diet. It's very difficult to do. However, short-term bouts aren't that hard to convince people to stop doing something. So in this case, I really educate people on reducing the amount of sugar intake they have. We have a great infographic on ChiroUp I incorporate with all my inflammatory type conditions to help get that inflammatory process knocked down a little bit. You can also use supplements, not something I do in my practice, but there's a lot of good papers on that. Vitamin C and collagen synthesis, you got omega-3s and decrease in inflammation. There's a lot of different things. I'm not the guy for that. However, I have a person in my area who does my nutrition for me. It's a great referral network. So that's one way, bring up the healing capacity of somebody. The next piece is going to be capacity. This is the one that most of us look to as far as our rehab to prevent this from happening again. And I think there's 3 things here that I would do. The first is share load. Meaning, in this case, this person's running, making sure the entire bottom half, lower kinetic chain is working properly. If somebody's running on the outside of their foot, or they run with failure to get the full extension of their knee, they're going to transfer that force upward. Maybe they have too much pronation in their foot, maybe they just run on a bank surface. Finding the activities they do and getting that to stop, but we really want to make sure that everything up to that point and past is moving good. There's nobody better than chiropractors to assess that and to treat that. The next part of that is going to be to strengthen. And a lot of times I'll get people who are really good at one of these things, and much better than any one of us, and this is all they do. They strengthen everybody. They do supplements with everybody. They manipulate everybody. Those things are all important in isolation, but you have to attack them all. So when you get into the strengthening component, do your isometric strengthening. Throw some tensile strength or stretch across that area. Get it to remold. Do some eccentric strengthening. I don't care what you do. There's some good research on eccentric strengthening, isometric strengthening to decrease pain and increase strength. But whatever it is you can find efficacy in your own clinic, do it. But we have to build and increase this capacity. Give them those exercises. It makes a big difference. The last and probably the most important one that I think that sometimes you have to throw a little creativity into is going to be to change the movement. In this case, it's running. If someone runs with a crossover gait and their feet are coming over at the midline, it's going to force them into increased speed of pronation, internal spin of the tibia and also the femur, force internal rotation at the femur and the acetabulum, and also stretch weakening of those glutes. So their activity is causing their pain. If they run on a bank surface the same way, they run around a track and they constantly go in a circle and go the same way each time, one leg is going to act shorter than the other. So making sure you dive deep into what that person's doing to make sure that you're addressing all the possible factors related to their injury. So that's how I normally will build up capacity. This last one is, I think, probably the most interesting, to be honest with you. I do a lot of reading on this, and I still say that I'm not an expert in it. However, the more I learn, the more I think it's important, and that is this. So I just said that that's the capacity line. That's where most people are going to have a musculoskeletal fault. They're not gonna, they're gonna hit that point, they're gonna injure themselves. However, that's not always where people feel pain. Sometimes people get off their couch and feel pain right here. Sometimes people aren't very active, and now they just get up and walk to their mailbox, they're experiencing pain. And that's a big deal. They may not even get to running the first day without having pain. So is it a pain processing issue, or are they truly doing any kind of tissue damage? Well, if you just got up and walked to the mailbox, chances are you didn't tear anything. That's a pain threshold issue. There are some things you can do to help this also. So the first one is exercise induced. Meaning, get them to exercise. Exercise-induced pain, it really helps down-regulate the amount of pain someone has. Getting them moving helps with their pain processing. So that's the biggest piece as far as just getting them to move and do something. The next is treatment. Now, clearly, I don't need to tell you guys, however, we need to be doing modalities and methods that help with pressure pain thresholds. Spinal manipulation works really well. Things like dry needling work well. So finding those soft tissue techniques or even manipulation that works well to help get that person moving, to shear the proper load and get them into their activity as soon as possible after their pain. And the last one is psychological. This is something that I don't have a vast amount of knowledge on. I have a psychologist right down the hall from us, and I think there's a psychological overlay. If I think they have chronic pain or like a post-traumatic stress syndrome, that's something that is possibly dealt with someone that has a a different education than yourself, or maybe it is you. But in any sense, this is a great referral network. This is someone that you're working with towards a common goal with your patients. So just like I said, I don't work with nutrition, I also don't work with the psychological aspect of pain, but finding people in your network, in your community that do, will help all your patients, hopefully in the future. So this is how I mostly deal with this paper, meaning I'm gonna take a specific and a very, very comprehensive look at someone's pain, and I'm gonna try to solve all those. Now, fortunately, I can. Fortunately, I can look at all these things and I can say, if someone comes in with a glute tendonitis, meaning when they first do it, it's probably more of an itis. If they keep on doing this over and over again, what does this turn into? More an osis. So that's what we're trying to prevent, that degenerated tissue. So what am I going to do? I'm going to educate them. So I'm going to stop that activity. I'm going to give them a PDF on how to have proper sleep mechanics per that specific diagnosis. I'm also going to give them a PDF on how to have proper nutrition through that condition report in ChiroUp, meaning ChiroUp is going to solve all of these problems. It's going to teach them about how to do it. We're going to give them the right set of treatments as far as exercise. And unfortunately, we don't get too much into that. It's out of our expertise. But just by making the diagnosis, which is what you need to do, ChiroUp will help solve and automate that 90%. So hopefully, we don't get those patients who go from a simple itis to an osis and turn into a chronic pain patient. These are just my thoughts. I am all for everybody being a case study of one. I think that 2 to 5% of treatment really makes us great at what we do, and I really try to automate the rest so I can really devote my attention to making sure that I solve the true problem behind that person's pain, which is often multifactorial. I hope this helped. I thought this was an excellent paper, and it really sets the precedent for what we should be doing. We shouldn't focus on simple methods. We shouldn't focus on being better at selling supplements. We shouldn't focus on just being the best rehab person or the best educator. We have to be the best at all. And if we can do that, we can move the needle at how we move our profession and change the perception of our profession.